न्यावाला छो ने
All right, we are live now. Good morning, good afternoon, good evening, all over the world where we belong and where we are joining from. Today is our 13th Global Zoom conference. And we have titled as Human Needs or Human Rights. What will be the connection and preference between the two post-COVID-19? So we will be focusing on the topic that was provided to all our respected panelists. To begin the session, there is two sessions we are going to host today. First session will be the presentation of our respected panelists on the topic provided, and second session will be 15 minutes if there is any questions asked by our audiences, which we are on live now. And as we all know, Girija Prasad Koirala Foundation has been established on 2011, and it headed by Honorable Sujata Koirala, the former Deputy Prime Minister and former Foreign Minister of Nepal, and she is also the chairperson of this foundation. Now, I would like to introduce all our panelists before we begin the session. And today, our respected panelists have accepted our invitation to present their views, share their experiences, and the opinions on this topic. First of all, I would like to introduce Honorable Sujata Koirala, former Deputy Prime Minister and former Foreign Minister and the chairperson of GPK Foundation. Please welcome Honorable Sujata Koirala.
Good evening.
Next, we have Ms. Vandana Rana, Vice Chair of UN SERA Committee, United Nations SERA Committee, and Chair of Global Network on Women Peace Builders, and co-founder and strategic advisor of Sati Nepal. And she is the only woman elected in the UN SERA Committee from Nepal. First woman elected from the UN SERA Committee. And please welcome Ms. Vandana Rana. Next, we have Ms. Bharati Silwalgiri, founder member of the Human Rights Organization of Nepal and advocate for global gender equality. Please welcome Bharati Silwalgiri.
Namaste.
Next, we have Mr. Jerry Jong Il, and he is the Division Director and Human Rights Activist from Business Environment Division, Ministry and Economy and Finance from the Republic of Korea. He is joining from Jerry. Next, we have John J. Mullerland Jr., attorney at law and human rights activist. He will be joining soon. Then we have Professor Kapil Shrestha, Vice President of National Election Observation Committee of Nepal and senior human rights activist, Professor Kapil Shrestha. Then we have Viviana Christie-Sevic, Executive Director of Sejil.org and human rights activist, Viviana Christie-Sevic. Then we have Dr. Uzmal Gul. She will be joining soon. She just texted me. UN Youth Ambassador, former Asia Pacific Regional Head at the Commonwealth and Global Advocate for Human Rights at Peace. She will be joining soon. Then we have Brahmanand S. Singh, award-winning filmmaker, author, speaker, and CEO of Mobius Films. Brahmanand Singh. Okay, they are joining. Then we have Morshid Alam, freedom fighter. He fought for democracy in Bangladesh in 1971, and he is the first South Asian elected official in the history of New York. Please welcome Morshid Alam.
Good morning, and thank you for inviting me.
Then we have Sumitra Magrati, youth activist and of marginalized community and co-initiator of Dalit Dignity First, Sumitra Magrati. Then we have Keval Singh Rathod, attorney at law and national convener from India, convener of Samajik Ekta Jagruti Mission. Keval Singh
Thank you
Rathod.
so much. Thank you so
Then
much, sir.
DP Kafle. He will be
Thank-
joined soon as well.
Thank you very much, Somjay.
He joined already, okay. General Secretary of People's Forum for Human Rights, Bhutan. Then we have Mo Chan, Executive Director of Burma Point, and he has been fighting for democracy for Burma since 1999. Then we have Dimple Willabus, President of StalwartsYouth.com and social activist.
Hi, thanks for having me.
Okay, now, without any delay, I would like to invite Honorable Sujata Koirala for her welcome remarks.
Thank you. My sincere and warm greetings to you all. And I would like to thank Somnathji for organizing this Zoom conference. We live in turbulent times. COVID-19 pandemic has created significant impact on human lives in every country in the world. The world is grappling with global health emergency. The worst victim has been the human capital, its health, skills, and knowledge. The pandemic has devastated the economy. It is rampant and likely to extend to 2021 also. It is worrying that countries do not have any meaningful national-wide capacity for real-time public health facilities, and the invention of vaccine is in long wait. COVID-19 has also impacted on both human needs and human rights. Individuals have both material and spiritual needs. Material needs include food, clothing, shelter, medical treatment, and schooling. Borderline between needs and rights is not sharp. I believe needs come together with human rights as part of the human security. Regulations are important to ensure their protection, and provisions made for protection should be duly implemented. The domestic context in different countries vary, but it is important that relevant guidelines are following at all levels with a sense of urgency and sensitivity. Government agencies have lead role in the implementation of regulations and guidelines to stop violation of human rights and ensure that basic human needs are in place. Accordingly, the use of information technology should be done in a responsible manner for the protection of weak, vulnerable, and marginalized groups. COVID-19 has confined us to home. It has caused loneliness, depression, anxiety, and also domestic violence. Women have been its worst victims. It is important at this stage make them feel loved, cared, and respected by others. People also desire to have esteem, value, and participation. Abraham Maslow has created a hierarchy of needs starting from physiological needs and progressing to security and safety needs, social needs, and friendships. At the peak of Maslow's hierarchy is the self-actualization needs. At this stage, people's needs are presumed to have achieved their full potential as human beings. Here, an individual has both esteem and participation. I feel that from basic needs to the enjoyment of human rights, there should be adequate provisions in rules and regulations for their provision, protection, and promotion. Thank you. Thank you, everybody.
Thank you, Honorable Sujata Kaya, for your welcome remarks. And I would like to invite our respected panelist, Ms. Vandana Rana, who is Vice Chair of United Nations SERA Committee.
Thank you, Somji. Thank you so much to the GP Koirala Foundation for giving me this opportunity to express my thoughts on the topic that you have given, which is human needs or human rights. I think these two are very interconnected. However, in Nepali, when people look at it, we say human needs comes first. In Nepali, we say gas, bas, kapas, which is, food, shelter, and clothing. So I think that is the key, but how are these needs responded to by governments, by entities? What is the access of the humans to these kinds of resources, the opportunities, equal opportunities, the distribution mechanism, how people participate in the designing of the distribution or access to these resources? That is where the human rights comes in. So I think these two are very, very interconnected. And that is where the United Nations comes in, because you do need to monitor the human rights principles that the UN Charter, the UN Charter introduced so many years ago. I want to share one story. In Nepal, several years ago, I think it was around 8 to 10 years ago, I was in a community, a rural community. We have women's groups. I work in, ensuring gender justice. So that is where I'm going to focus my presentation on. You have said 7 to 10 minutes. I hope I will not take more than that. And this lady, I was talking about United Nations and how important it is, and what are the principles that UN has brought about. It was a topic on women, peace, and security. And then this community woman, they started, because this was just post-conflict, and they said, oh, like people like you have come several times, given us lots of hope. So we don't want to hear where the UN is. We don't even know. It's so very far away. What we want now is shelter, food, security, happiness, education for our children. And I was a little taken aback, and I didn't know how to respond to that, because I did feel at times we do share false dreams, So, but then there was a community lady who stood up and she said, wait a minute, in Nepal, in the rural communities, water is very scarce, even in the urban communities, actually, several times. So they have to walk several miles to fetch water. So this lady stands up and she says, suppose if you bring a bucket of water and you want to bathe yourself, if you start from your feet, you may, if you are not cautious, you may waste the entire bucket by just washing your feet. But if you are very cautious and you start from your top and you cautiously do it, then you will be able to bathe your entire body. So that is what the UN is all about. And this was a community woman who explained, that is what the UN is about. So unless and until we actually try to influence the policies that UN brings about, it is not going to ripple down to us. And I really like this story and the explanation that she gave so simply. So this is where I think the UN plays a very, very strong role in monitoring the human rights violations and ensuring that governments are accountable to their commitments to abiding by the human rights, several treaties and agreements. I would just like to pick a little bit on the COVID impact and the disproportionate impact it has had on women and girls. I would just pick up 4 points. One is, Sujata ji also mentioned that domestic violence has increased. Even in April itself, the UN came up with a policy brief, which already the Secretary General said that domestic violence is a shadow pandemic. And we have been hearing increasing violence, reports of increasing violence, even from the most developed countries, like China, France, UK, Germany, Italy. They have said that 35 to 40% violence has increased. And this is still, they say, is the tip of the iceberg. If we look at Nepal also, there have been some indicative rapid assessments which suggest that there have been a rise of 50% violence that has increased during the lockdown. But we don't need actually statistics. If you are working in this area, you already have statistics where you say that 1 in 3 women, have faced violence. They face every other day. And out of the violence that women face, in other parts, it says 40%, but in Nepal, it is 70% is domestic violence. So when we know that you are in a lockdown and you are confined with a perpetrator who has a violent mental attitude, then we can just imagine, we don't even need statistics, that if a person is confined during a long period of lockdown with a perpetrator, and she does not have, if you are in a very confined place, then you don't even have access to telephones, you can't even call a friend or just go out and share your misery with your friends. And the kinds of support services, shelters, psychosocial counseling in the earlier stages, they themselves were weakened because this was such an unprepared pandemic that even support services and entities did not know how to respond to it. So we can just imagine the increase in the violence that is there. So this is something that the UN has been really asking member states to look into and prepare and announce that violence against women, shelters and support services should be declared as under the essential services, which has not been done yet. Because I work in I give strategic advice to an NGO called Sati, and during the time we run shelters. And I remember we wanted to establish an emergency alternative shelter because we could not take in new residents because of the risk that they might transmit the virus to the other older residents, because there was a lack of testing at that time. So we tried to open an alternative emergency shelter in a head office, and we needed to purchase things. But the CDO office did not even give us a license, saying that the shelter services are not under essential services. So these are the kinds of things that UN is bringing up. The other impact is health. We know that 70% of the frontline workers are women. Only 30%, in fact, they say 70 to 90%, that's the statistics that's coming in. And only 30% of women in health are in decision-making positions. If you look at the PPE, it's a standard size PPE, it may not even fit the women. So they may risk, catching the virus. There are lots of security issues in regard to health, but not only about frontline workers, but also about access to health. There's been a deprioritization of maternal mortality health. And in 2000 to 2017, the maternal mortality rate had fallen down by 40%. Now there's fear that this is going to rise again. So that's the health. And so access to health services, because, standard hospitals had been transformed to COVID hospitals. So the services that they were giving in other times were not given in standard hospitals. So that's something that we need to look into, and states need to see that universal health coverage introduced and women have access to all kinds of health services. I think the biggest impact is on the economic impact. Most women work in the informal sector or in hospitality services like hotel, tourism, even teachers. And ILO has said that by June, 70% of domestic workers have lost their jobs. And yesterday I was reading a article in Kantipur newspaper, where they say during the lockdown, 41% of women lost jobs compared to 28% of men. This is in Nepal also. So there was a study on that as well. And we have also migration issues where women migrants, many of them are returning homes. Many of them no longer have lost their jobs. And some of them are not able to return because there are illegal migrants as well. And they are under a contract who is not monitoring anything. There's no monitoring about it, So there's more abuse, and they are expected to do much more work during the corona, which make them even more vulnerable. So that's the kind of economic impact that we have. In fact, the UN policy brief has also said that by next year, 47 million women will be living an impoverished life and will be pushed back into extreme poverty. By 2021, there will be 118 women to every 100 men between the age of 25 and 34 who will be pushed into extreme poverty. And by 2030, the Sustainable Development Goal agenda, it will be 125 women per 100 men that we pushed into extreme poverty. So these are the kinds of impact, just to give you a tip of the impact, the disproportionate impact that the COVID has. And considering all this, I want to say that the UN, of course, we can be very critical. I know we are all critical about the UN and what it does, but that's the only option we have. And we need to make it even stronger as member states and see what it can be done. UN has, of course, said that women's human rights, women's needs are its top priority during this COVID, and has urged governments, even CEDAW has come up with a CEDAW guidance note with 9 points, where it talks about, of course, gender-based violence, addressing gender-based violence, access to health services, and developing immediate national response programs with women at the center, with women's participation. So this is the key that is the UN has been urging, including CEDAW, which looks into the discrimination against women and girls, and we have also come up with a guidance note. So just to tell you that this is the interconnectedness between the human needs and the human rights, where the needs of women always fall at the bottom ladder. So that is where we need to see that inequalities are not exacerbated, that we address inequalities in terms of designing our response programs, our services, and that's where we all need to work. Collective work, I think, is the key, whether you are a civil society, whether it's the UN, or whether it's the government, academics, politicians, all needs to work together and make sure that this COVID does not exacerbate inequalities. In fact, it may be an opportunity to see what was going wrong and where we need to invest more and address inequalities. So I'll stop here. Thank you so much. I may have taken a little bit more time. I'm sorry about that.
Thank you so much for your input and opinions on the related topic, Vandana Ranaji. We look forward, like you said, everyone should work together to make better incoming new world. Thanks again. Next, I'd like to invite Mr. Jerry Jong Il on. He has another Zoom meeting. He has to leave, so I just prefer him to present his presentation, whatever he has. And before that, I'd like to acknowledge the panelists who just joined. John Muluhan Land Jr., attorney at law. Dr. Uzmal Gul, United Nations Youth Ambassador. Then BP Adhikari, legal advisor of Inhurit International. They just joined this meeting. Please welcome Jerry Jong Il Hoon from South Korea. Please unmute.
Can you hear me?
Yes.
Okay. I will share some the presentation material first before starting my talk.
Okay, I'm sharing the screen.
Would you please accept the screen the sharing?
Yes, I share.
Okay. Sam, I sent the presentation material. Please share this file on the screen.
Yeah, I just share it.
Okay, please.
Okay.
I cannot share my presentation material now. So, yeah, given the presentation material, please share this.
Okay, I shared it. Did you see it?
Uh-huh. I can upload it.
I just share it. Can you send me the invite? I accept.
Uh-huh. Oops. Maybe it's that.
Yeah, it's been shared already. Just accept it over there.
My Zoom is not allow for the upload my presentation material.
Okay, hold on. Can you send me the invite, please? Send me the invite from your side. Yeah, it's already, it said your screen sharing is okay. Can you accept?
Yes, this my presentation material is not the upload. I just in the talking. Actually, I am one of the economic the bureaucrat of South Korea. So I'd like to make it clear that what I'm saying here today is from a very personal perspective. After a lot of the consideration, as I search for the objective data related to today's topic, recent survey conducted by the Human Rights Commission of Korea was related. So I selected some data and translate it to the presentation. The survey name is National Awareness of Discrimination. Actually, this survey conducted in the middle of the COVID-19 in South Korea. Actually, the National Human Rights Commission of Korea conducted the perception survey to look at the overall the national awareness of discrimination in order to seek the policy direction to correct discrimination. The survey showed that the people, the sensitivity to discrimination has increased with the COVID-19, and that they think the society should make active effort to resolve discrimination. In addition, it was found that many
yes,
people
you can accept now. It's working sharing.
Okay. Are you sharing?
Yes.
Okay. Just to share the presentation material. I am talking at the continue. In addition, it was found that many people agreed that the institutional measures such as the enactment of the anti-discrimination the laws, as well as education and awareness improvement needed as a way to resolve them. That this was a little higher than the result of the hate discrimination national recognition survey conducted by the NHRC in the 2019 last year. NHRC means National Human Rights Commission of Korea as of the government organization. Actually, South Korea take the lead survey in the middle of the COVID-19 period. The survey result is opened by the Human Rights Commission of Korea's the homepage. Actually, the data is so big within the Korean language only. Therefore, I translate to English from the Korean for the alignment to today's the webinar topic and the summary to COVID-19 related issues. The survey was conducted by the Human Rights Commission's the Public Opinion the polls agency, RealMet, which conducted wireless mobile the survey of 10,000 men and women aged 19 or older across the country from the April 22 to the 27 for 6 days this year with the sampling error plus minus 3.1% at a 95% confidence level. The next, the choose the topic is whether or not in discrimination spread of the COVID-19. The survey question was, do you think there are people or group that have been a target of discrimination or discussed in the recent worldwide spread of COVID-19? Given the recent spread of COVID-19, 69.3% of respondents said their target to discrimination or disgust, but just 30.7% are saying they were not. The rate at which COVID-19 responded that there are targets of discrimination due to the recent spread is similar to the overall result, with no significant the difference in the gender, the residential area, the religion, or the ideological orientation. The 693 respondents who answered yes will be a more specific explanation in the next page. The topic is in the target of discrimination spread the COVID-19. This the question is the same. Actually, the answer is the so variety. I sort the ranking. Number one is religious, the person and the migrant refugee is second. Is third is specific region, and last one is the patient. So many the variety. But this, according to the survey of the 693 respondents who said they were target to discrimination or disgust due to the spread of COVID-19. 60% of them were religious, followed by the 36.7% of those from specific religion. Here in the survey, the first priority is to choose just one, and the second priority is to choose two answers. Selection during the survey agency kept asking to the people the same question. Religion was the highest in the two categories of discrimination following the spread of the COVID-19. In my personal point of view, the result reflect a surge in the number of the coronary the patient at the Christian rallies in Daegu City, Korea. Actually, the Daegu City is the eastern area of the Korean Peninsula, just before the survey. Next topic is the target of discrimination spread of COVID-19 is continuously. This survey question is just as the spread of Corona-19 has led to hate and discrimination against Chinese and others in our society. There have recently been incidents of hatred and discrimination against the Asians in Europe and United States. Have you ever thought with the opportunity of Corona-19 that my eyes or actions that hate and discrimination against someone eventually return as a boomerang, or that I can also be target or social minorities of discrimination? Actually, this survey, the question and the response result shows you the sensitivity of discrimination increases with COVID-19. Actually, 9 out of the 10 Koreans think I can be discriminated target too. No one is free from discrimination. 9 out of 10 respondents agreed thinking that I and my family could someday be discriminated against or targeted to discrimination. In particular, 9 out of 10 Koreans said that they have thought that they could be target to discrimination or social minorities at any time in the face of the global spread of COVID-19, which led to the increase in the sensitivity in people's discrimination. All levels of detail, including gender, age group, residence area, and occupation, were found to be highly sympathetic in this idea. And the next one is the reason why depending on discrimination in society. For this question, it was what do you think is the reason for the depending discrimination in our society? Actually, this answer ranking sort number one is the economic inequality. And next one is lack of respect for diversity. And next one is job shortage and intensifying the competition and the spread of the political of media propaganda and the absence of legal control and etc. According to a survey to 400 respondents who answered yes, in terms of the degree of discrimination compared to the past, each of them asked 3 reasons why discrimination in our society, in depending the people cite the economic inequality, including the gap between the rich and the poor as the highest at 78%. First of all, we believe that the reasons for such depending discrimination should be understood first and analyzed so that the counter plans mentioned on the next topic can be properly formulated. And now I show you the counter plans about discrimination. For this question was the following is response policy to discrimination. What do you think of these individual policies? The countermeasures and the action plan policy about discrimination. The public recognized discrimination as a social problem that should be actively made effort to resolve it, 93.3%. And many agreed that the institutional measures such as enacting laws to guarantee the right to equality are needed as a way to resolve discrimination in our society. The survey shows that the public consensus on the need to enact laws to guarantee equal rights is growing little by little, with 72.9% higher than the height discrimination people's the perception survey conducted in last year. Actually, the public has strengthened the education and the campaign for the improving public awareness, 91.5%, expanding education for respecting human rights and diversity in schools, 90.5%, and act laws to guaranteeing equal rights in the regulating discrimination against the politician and media and online media also, and then establishing the comprehensive measures at government level. And the destination of the malicious in the discrimination and the destination by the organizations such as the Human Rights, the Commissions of Korea. Yeah. As I said at the beginning of my presentation, I am actually the economic official in Korea. Therefore, I'd like to clarify that in today's topic, the human right. Yes, in the very personal the capacity. So if you want more informative knowledge related to today's topic, I recommend then you get more the information. Here is the Korea Human Rights and the commission will hold in a conference on the upcoming September the 17th. So the National Human Rights Commission of Korea will co-host the 2020 the conference on the combating hate and discrimination with the European Union and Asia Pacific Forum of National Human Rights Institution, APF, on the 17th September 2020 on the theme of the implementation of the strategy and the action plans to address hate and discrimination. I think this event will be a very useful opportunity for you, as it is a very big the conference involving not only Korean experts but also international experts also in the joining event. The deadline for the registering the webinar on the conference's website is September 1st. So the COVID-19 cannot be resolved by any country alone. So the global threat should be responded and solidarity internationally. Let's respond together the both human rights and corona also. Okay, this is my the presentation today. Actually, I have to join another meeting in South Korea now, so I have to quit and log out this webinar. Please accept my apology with you understanding my situation. But if you have any questions or the comment regarding my presentation, please feel free to in the email or then whatever, please. It will be highly appreciated, and I will be the review and answer. After I want to check the YouTube and GPK homepage, your story the day after tomorrow or tomorrow. Okay, this is my presentation also. Yeah, thank you.
Thank you so much, Mr. Jerry Jong-il Ahn, for your valuable presentation. And if you can share the paper, presentation paper in our email, I will definitely forward it to all our panelists and all our audiences who are watching live on our social media. Thanks again and for your valuable time. So next, I would like to invite Viviana Kristicevic, Executive Director of Social.org and human rights activist. Viviana Kristicevic, please welcome her.
Good morning and good afternoon and good night. I'm very honored and happy to share with you. I'm a human rights activist. I was born in Argentina, and I've been working primarily in Latin America for the last 30 years. I head a regional human rights organization that works on civil and political rights and economic and social rights. And we have been also dealing a lot with some of the challenges that COVID has presented to all of us. And I welcome this opportunity as well to feel part of a global community and to be able to share and learn with all of you. So I think now we have the challenge of thinking about needs and rights, and I will put my clock on to be able to keep the time. But as many of the presenters that preceded me said, is not necessarily a choice between needs and rights. Rights are ways of ensuring basic needs. Rights are ways of ensuring that we live lives free of violence, that we have our dignity respected as individuals and as collectives, as groups, as peoples, that equality can be expanded, that shelter and health are respected, that beliefs are respected, and there's a healthy debate and possibilities of dissent. And then there are guarantees for the enjoyment of those individual but also collective rights, these possibilities of fulfilling our destinies, and self-realization as individuals, as members of families and communities and nations. And rights crystallize some of those limits of others and the states on individuals, but they also require positive actions. They require money, they require procedures, they require bureaucracies to guarantee the rights of all. So I think that we can all agree that we cannot have access to education without a functioning school system. But I think under COVID, we've seen how the right to health needs also a lot of positive measures, not only negative measures. And we have been having, I think, in different countries and globally, these talks about the right to a vaccine and universal access, and what would that mean for all of us in different countries, in different contexts. The importance of the right to health, what does the right to water mean for many communities, and how that is linked to the realization of rights and the right to survive and live and have a healthy life. And there are many ways of grounding these links between these needs and rights, and I think different communities and schools have grounded them in different founding documents and traditions. And one of those traditions and founding documents is found, as Ms. Bandana was saying before, in international human rights. And because many of us have been part of the process of using international human rights to expand freedom and equality, we also know that the definitions and the scope and the ability of human rights to permeate is not defined in some faraway document and institution. That is mobilized by what we do. We have been basically pushing the scope of recognized rights as part of a global and national community in many ways. Women's rights is one of those areas where 30 years ago we had to, I had university professors that would say a woman will never get the higher grade in my class, and I'm a lawyer. So in a country with a constitution that promoted equality. So we as a community helped also realize and recognize the scope of rights, how things that were happening in the family and were part of the private sphere were part of the scope of recognized rights. And now we have a situation that pushes us profoundly because of the inequalities that is revealing and increasing currently, and for what we're seeing in the coming future. I think the numbers and predictions that are coming from financial institutions, from our governments, from the UN are scary. In Latin America, for example, they say that 50% of the population will be in poverty, that there will be a contraction of 9% of our economies. And those look like numbers, but we know what that means in the lives of women and children and men and communities is scary. It has an incredible human toll. So not to despair. I think that we have also a challenge. And it's a challenge about the type of world that we want to live in, and the world that we can live to our children, and that we can build together with our children. And I think that that calls for facing different types of inequalities and responsibilities. And I think the lens of rights can be very useful for that. I think that this time calls for rethinking social rights and what they mean in our communities, and how are we going to ensure that we have access to health and survival, and how those rights are interlinked with the right to access to information, but also the right to privacy. So this interlinked, but this importance of social rights, I think, is critical. I think another area that is very critical is the future of the planet. I think we cannot think that, well, now we're dealing with COVID, we can just pause what is going to happen with the climate emergency, because they are interlinked. And that is one of the major threats that our communities face. And I think many of the communities that will be most affected are the ones that least contributed to issues of climate emergency. And that calls for understanding inequality and cooperation and solidarity with a very different lens. And so my contribution to this conversation, coming from the experience that we have in the Americas, and more specifically in Latin America, is a message and a bridge of hope and creativity, because I think innovation and strength and the solutions that we need for the problems that we're facing will spark freely around the world, hopefully. And I think these communications and these bridges are the ones that call me to participate in this fora. And as it was said very well before, I think that it's time to come together to find the solutions that we need for a more hopeful and equitable future. So thank you.
Thank you so much, Viviana Christie-Sevic, for your valuable inputs that you share among us, your experiences. And hopefully, like you said, we all need to work together as united to beat our problems and work for the solution. Thanks again. Now, I'd like to invite Dr. Uzma Gul. She is also the UN Youth Ambassador and former Asia Pacific Regional Head at Commonwealth. Please welcome Dr. Uzma Gul.
Unmute myself. Hey everyone, thank you so much, Somnathji, for inviting me here, and thank you everyone for being here, because for me it's very early morning, so on a weekend. So thank you so much for being here, and the speakers who were talking before me were like really giving a nice input into this topic, because this topic was really a need of time in this crisis, because it was a public health emergency, but far more it is what I felt was economic crisis, social crisis, and a human crisis that is now becoming more a human rights crisis and human needs as well. Because most of the time we saw during this pandemic that people were neglected, they were abused, and the rights were not put it in a way that was supposedly given to people. So in February, United Nations launched a call to action to put human dignity and the promise of Universal Declaration of Human Rights at the core of our work. Human rights cannot be afterthought in times of crisis, and we faced the biggest international crisis in generations. So for us and for this conference, the message is clear that the people, their rights, their needs must be front and in the center. So human rights lens actually put everyone in picture and ensure that no one is left behind. Human rights responses can help beat the pandemic, putting a focus on imperative of healthcare for everyone, because we have seen that it was not the virus that discriminated, it was us, it was the people, and the impact of that coronavirus that created differences among people. We see the disproportionate effect on certain communities, the rise of hate speech, targeting vulnerable groups in different countries, especially the people who were refugees or asylum seekers, or the old people, like we saw old people left alone in the care houses. The dead body corpses were left in the societies. Nobody was going to touch them. Nobody was doing the funerals and everything. So the life was like stopped, and it was impacting people psychologically, because students were not going outside to the school, or they were not able to play outside the home. Some of the females were at home, because before this we were having a conversation with the Commission on Status of Women with United Nations, and there we came to know the numbers where domestic violence increased, sexual abuse increased, child abuse increased, being at home, because you don't know who is psychologically being impacted by that COVID, and then they are taking out that frustration at the person available in the home. So it was not the virus, but all the impacts of that virus were affecting the human and the people. So, and then against the background of rising ethno-nationalism, authoritarianism, and pushback against human rights in some countries, like being a country like in Pakistan, because I'm from Pakistan, although I'm not here there in the country, but the thing is that we were proactive in approach. The province Sindh was very proactive in approach, but the federal government, there were clashes between the federal government and the provincial government, because some of them were not able to understand the crux of that disease, and that is how so many people were left far behind by getting the responses from the government immediately, because it was affecting human needs, and most of the people who were below that line, who were below that poverty line. So the government was supposed to give them or afford them things that they were not able to do. So everything was on a halt. So the threat was not the virus, but we the people. So thank God we are coming out of that, and looking ahead forward, we need to build back together. Sustainable development goals are there, which are underpinned by human rights, provide the framework for how we can be more inclusive and build sustainable economies and societies, because we were in this together, so we have to come out of this together. Although virus threaten everyone, but human rights and working for human rights uplift everyone together. So the recovery must also respect the rights of future generations, because we have to figure out that in future, if we are coming across with the same wave, and how we can tackle it, because it was so unexpected, and people, especially the governments or the leaders, were not ready for the responses and how to deal with this. So by respecting human rights in this time of crisis, we can build effective and more inclusive solutions for the emergency of today and recovery of tomorrow. And this platform is really a good platform where every person from different countries and with a lot of experience are here. So I would request and suggest that we should need and we should come up with more solutions for the government, like in sense of policy making or structurizing something that we can promote it on our social media and to the government people, so they can further jot it down to the governmental grassroots and help people who are in crises. Thank you.
Thank you so much, Dr. Uzma Gul, for your valuable inputs and the suggestions and the ideas that you generally give to us. Definitely, we will work together for a better world in new normal. Thanks again. Now, I'd like to invite Mo Chan, co-founder of Burma Point, and he has been promoting democracy for Myanmar, Burma, that used to call Burma, now Myanmar, since 1999. Please, Mo Chan.
Yes, thank you, Sonap, and also GPK Foundation for giving me this opportunity. And I salute all those previous speakers for the work that you all have done and continue to be doing. And for my part, just a few things I would like to highlight. In the case of whether it's human needs or human rights, as many of the previous speakers have spoken loud and clear, they are all they both are intertwined. And from my aspect, due to COVID-19, in New York City, where I'm located and where the Burmese community is, I would say within the first wave, and now we are expected to experience the second wave. Hopefully we don't have any more deaths. But during the first wave, we had more or less around 20 deaths in my community alone. And my community is possibly more or less about the same as Nepali community, or maybe Nepali community is maybe even a little bit bigger than our community. And 20 deaths, that is compared to my native land, which is Myanmar or Burma. They have more or less around 10 deaths. Okay, and with the population of 55 million in the country, more or less around 10 deaths only. Hopefully it doesn't increase more, but compared to our small community in New York City, we have somewhere around 10,000 people. We have 20 deaths. You know, so you can figure, you can calculate easily what the difference is. Even though in New York City, I would say one of the biggest capital of the world, the biggest cities of the world, and we are having rights. We are having rights compared to many other countries in the world, even though there are circumstances in the United States where immigrants are not welcome among other communities or races. This is an ongoing challenge, I would say, in many parts of the country, the world. But in New York City, we have rights, and the needs are also given and supported by the government, the local government, city government, both city government, the city government, and also the state government. Even when that is the case, we don't receive 100% rights, unfortunately. Why? Because the system has, I would say, some holes in it. I would say, and system has some gaps in it where even though the same system applies for everybody, of course, the society and the I would say, such as, for example, as a hospitals don't operate the same way, right? So the more money, some hospital have more money, and because of that, they are able to hire better doctors, more nurses, better nurses, whereas they welcome rich people, people with better insurance, and they provide better solutions, medical solutions to those COVID, infected patients. But whereas in many immigrant communities, hospitals that we have to rely on are government, facilitated hospitals. Even though our rights, our rights are the same as anybody's rights in the biggest city of the world, but at the same time, the facilities and the needs that are provided to the immigrants are not the same as others within the same city. So, these are some of the challenges that we are facing today. Even though we are given this, supposedly given the same rights, the rights are not the same. So, but if you look at if you look at the numbers in New York City, total deaths are more than 23,000, and of which 20 people, at least 20 people from my community. And when we die, when people die, we all go to the same, we all say goodbye to everybody, so the death is basically, in a philosophical sense, the same, but before we die, the process that we go through are not all the same, unfortunately not, even though we are given the same rights. So it's a big challenge. It will take a long time to fix many of these loopholes, and even for us, a small community, just like a Nepali community in New York City, we are continuing to highlight and point all these loopholes, and even for that, it takes time. It takes time, and sometimes leaders don't have time to listen to us, unfortunately not. And so, but we still have to keep on fighting, because at least that is also another right that is given to us, the right to fight, the right to, to take it to court, or the right to take it to the government and lay it down and let them see, what the problem is. So at least that is good in a positive sense, in a sense, and that we can continue to show the government
Yeah,
what's going
thank you.
on, what's wrong with it. But otherwise, if we don't continue fighting, if we don't continue showing the official what's wrong with it, sometimes they neglect it because they don't have time to put all their efforts on small. To them, maybe it's a small issue, but for us, it's a big issue. Nevertheless, we just have to keep on fighting because that's our right, and that's also becomes need because otherwise our people will continue dying. So
Yes, yes.
this is
Thank
just a
you.
this is just a simple case scenario of our situation. Thank you.
Thank you so much, Mo Chan, who is also the freedom fighter fighting for democracy for Myanmar since 1999, and we are working closely together. Now, I would like to invite Brahmanand S. Singh, who is also the award-winning filmmaker, actor, and speaker, and CEO of Mobius Films. Brahmananda Singh, please welcome.
Yes, this is a lovely forum, and I am very excited to listen to everyone, what they are talking about. And I come with this debate from an artist's perspective and a human perspective. And I think that I have made a film on human trafficking, and I see that rising, surprisingly. So these things are alarming to me. What is much more alarming to me that, the entire debate topic, human needs and human rights, I understand the technical difference, but they're not very different. They are like, I think Viviana pointed out that they are born of each other, that rights are born of each other. What has really been very appalling for me in the past 5 months, almost 6 months, almost, is that whereas every single government, every single television channel and other media has been bombarding us with COVID, 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 they are only frightening us. They are only scaring us. I have not seen a platform emerge where there is counseling that is available. There is a positivity that is being talked about, that yes, this is a crisis, but there are ways in which you can cope within that. There are any number of people that I know who are going through depression, anxiety, they are cracking up, and these are low vibration people, they get attacked by anything which is a crisis. It's not just COVID. I mean, there were farmers who were committing suicide for $100, and things like that in Vidarbha. So these people get panicked and anxiety ridden very easily. But where are we? Couldn't we be talking enormously? Couldn't we have a body where anybody who is going through domestic violence can come and counsel, can come and talk, can come and seek help? I mean, technically there are platforms and numbers and emails and things like that, but I've not seen a program. I've not seen an awareness program which is happening. I mean, there's so much of time being given to news time, but is there a counseling platform somewhere, even on the news? I mean, why can't it be? I mean, I'm sure it would have huge response. People would like to see. People don't always like to hear panic, though yes, it sells. Governments benefit by scaring you anyways. That's well-known thing. Okay, but what I'm trying, and the human needs has come up like never before. The higher vibrations, the need to be compassionate, the need to be understanding, the need to be kind, has everybody is understanding these things much better than ever before. And that is where I feel that there needs to be storytellers, there needs to be counselor, there needs to be professionals who come on a platform and create hope. I don't see that happening in the proportion that should be happening. There's a very interesting story about a mouse who was living on a farm with the farmer and his wife. along with a hen and a goat. And, this mouse overheard the wife of the farmer. Pardon? Is it related to Somnath, is it related with what I'm saying, or is it something else? Oh, can you hear me?
No, it was not related to what you were saying. Please continue.
Okay. So I was saying about this small mouse who was living with a hen and a goat, and farmer and his wife, and he overheard a very alarming thing. The farmer's wife had told the farmer that when you go to town today, can you get a mouse trap? This mouse is really, creating a lot of nuisance. And so this mouse went and consulted the hen first and said that, this is what I have heard, and I think I'm in trouble. So the hen laughed and he said that, well, yes, you are in trouble. And I think that, so the mouse said, can you help? Can you suggest? He said that, well, I can't think of anything, but it's your problem. Sort it out. And the mouse went to the goat, and the goat said, I mean, can you see my size? You are talking about a mouse trap, do you think that it's going to really affect me? And the mouse said, okay. And that night, there was something bizarre that happened. There was it was complete darkness, and there was a sound, a screechy sound, peek, 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 peek. And the farmer's wife got up, and she thought that probably the mouse was trapped. And instead, there was a snake that had gotten trapped. So the snake bit the farmer's wife, and she died. And the next day, there was like grief, and people started visiting. So the first casualty was the hen, because they cut that hen to serve guests, and a few days later, when there were more guests who visited to offer condolences, the the creature who was sacrificed was the goat for food. And eventually the mouse, the farmer, gave up everything, and he just locked the house and went away to mourn himself. And the mouse was free in the house, roaming around, enjoying the TV and on the bed and things like that. So there are two big lessons from a story like this. One is that you don't need much to get lucky sometimes. But two, that anything that you think is someone else's problem is not exactly someone else's problem. It's all our collective problem. And I think that that kind of a bonhomie, that kind of a connectedness is what COVID has given us an opportunity to understand in its spirit, not just in theory. So I would go that I think there are, but there were already mentions of domestic violence. I think imagine a household where they have not been getting along and there is some violence. 24/7 lockdown together, there is increased violence, and the woman can't go anywhere. Or it's just relationship hassles. Imagine anxiety, panic, um, being thrown out of job, depression, confusion, uncertainty. There's nobody who is telling them, giving them hope that uncertainty also means that anything can happen, anything good can also happen. Hold on, don't give up. Think creatively. Think what can happen if you're in business, if you're in job. It does not mean that you have lost your job and you have to just settle for that. Think maybe this is a big defining moment in your life. So I think that that is the call for human need, the call, other than and understanding and love and compassion and those kinds of things. And I think that is happening already. But there is still no forum. There is still no platform. There is still no comprehensive body as such, which which has gotten established in these 5-6 months, like the UN or something, of that sort, which takes care of COVID-19 positivity in the proper sense, not just positive in terms of the germ, in terms of the virus, but in terms of solutions, in terms of hope, in terms of self-belief, in terms of ways to deal with situation. This is by far the greatest human crisis that we have seen in our living lives, or perhaps even beyond that. I think perhaps one of the all times. And it's very different from even a great crisis like 9/11. It continues to affect people. It continues. We are fighting an invisible enemy, and it'll take some time for the vaccines to come out and things like that. But here, awareness is required. People are violating basic norms of taking precautions because there's no awareness. People are giving up. People are fed up. Sometimes people don't understand the enormity of it till it hits them, till the hen is sacrificed or the goat is killed. So I would say that there's a tremendous need to understand the human need. And I think the rights element is absolutely parallel with it. If there are great rights, we have needs addressed. If we have great needs addressed, we have rights automatically addressed. So I think on that note, I would hand over to Somnath, and it's a great panel. I'm loving everyone who's talking and speaking. Great ideas. Thank you.
Thank you, Brahmananda Singh Ji, for your very, very valuable inputs, and we will definitely get knowledge and then look forward working together. Thanks again. Next, I would like to invite John J. Mulholland Jr., attorney at law and human rights activist. Please welcome John. Yes.
Thank you, Somnath, and I really appreciate the invitation from the G.P. Kerala Foundation to be a part of this incredible forum and debate discussion. Before I sort of answer where I come down the human needs for human rights kind of piece of this, my answer is sort of informed by a lot of my professional experience in terms of the practice of law. I've done a lot of work I've done work with employment rights and consumer protection, and then I've done some advocacy work. I've done some electoral campaigns. I've now most recently worked in state government. And I mention that because I had the opportunity to see a lot of different local institutions and how they operate inside of a larger country. We think about the United States of America, but we think about how that breaks down to states and municipalities. And really that experience is somewhat universal the world over. I mean, even controlling for the strength of a democracy or an authoritarian regime, there's always sort of a friction between the center and the localities. And I think that really came to bear in this crisis because the whole world got struck and is still being struck by this awful global COVID-19 pandemic. And so in terms of the human needs or human rights, we all have they're very practical human needs that need to be that people need to get. And that only happens, we deal with scarcity, we deal with limitations, we deal with supply chain disruptions. That really only happens in an environment where people have the human rights to exercise and let people know what their needs are, both as individuals and as communities. And what I found, and I'll sort of break this down a little bit further, but what I found was that capacity to mobilize and that capacity to have the relationships. A lot of what Mo Chan spoke to a few presenters ago was really the key about whether a group was either left behind or was involved in the conversations that needed to be made. So and I think very broadly, obviously I can speak mostly to my own experience in the United States and in New Jersey and Pennsylvania, North Carolina, but as all governments were concerned, there was a policy decision had to be made, and it wasn't always made between whether a decision was going to be made at a central level or a local level. And just one thing that when I looked at the Kathmandu Times this morning, it was very interesting to see that the same schooling issue being dealt with in Nepal is no different than what we were dealing with in a place like Cherry Hill, New Jersey. That officials thought a decision was being made, there were rumors of a decision being made at a higher level, and then it got sort of kicked over to the locality to make the decision. And it's like, well, we need you to operate there, and we deal with a somewhat comparable situation of like access to technology, not on the same scale, but you think about Nepal, where there's 40% of the students have no access to technology. And they were told today to find a way to create these small groups that could meet safely. And I think the lesson there, and also in Cherry Hill, New Jersey, we had a situation where at first there was a directive from above that all the schools had to open in some form. And then there was rumors that maybe they were going to all go remote. And then they were told they were allowed to go remote. And then they ultimately decided to go remote. And I think what this situation has taught us is that we all, and that's why forums like this are so important, is we always have to be discussing and talking about what happens in the worst case crisis situation. Because a lot of times decisions aren't going to be made, or we're going to have to make them at the absolute last minute. And not that schools are my area of expertise, but I got to talk to a lot of school superintendents throughout the area. And they had talked that they had to almost plan for all three scenarios. And I think there's something really humbling about that we should think about for these broader human rights discussions. Is like, what do we do if we have to open 100%? What do we do if we're allowed to do a hybrid? What do we do if we have to go all remote? And how do we make sure that issues like food scarcity are resolved? That if schools are used in a country or community as a way to get food to people who are not eating or hungry. When we did our shutdown in this area of the United States, we had to make sure that there was a way to pick up school lunches still, even though there wasn't education happening. And so it's remarkable, just that fact that it's before you can even decide, you have to almost decide who's going to decide, and be prepared that while you think a decision's coming from somewhere else, it might ultimately be yours to make. And with that, it's really the strength of communication and trust between these levels of government, between nonprofits, between NGOs, between transnational organizations. So there needs to be relationships and lines of communication always going. I think the other issue that we saw throughout the world is when we end up in an emergency scenario where we're making orders sort of by decree or by executive order or by emergency order, transparency goes away. And it doesn't go away necessarily for a malevolent reason. It goes away because no one knows what the ground rules are. We all come up in our systems, in our communities, and we sort of have a sense of who's making decisions, who's influential, who to reach out to, what's the process, is there a notice requirement, is there not? And in an environment where something can be done by an executive on a piece of paper, everything can change immediately. But I think that that's not necessarily, we still go back to the same toolbox we have, and the same toolbox is access and the ability to present, mobilize, and bring power to bear. Because the only way you're going to get something resolved is if you can call those people up in the new who's making the decisions, or get out into the street, or petition. And I think that that's what we learned in this process. We had a unique situation when we were encountering our state level shutdown, where there was a rumor that one of our counties, which is a smaller level of government, was going to do a manufacturing shutdown. And this was like at the peak of this was about the end of March, beginning of April, when none of us really understood anything about this virus. We didn't know how it spread. And there was one area that wanted to be more protective. And that community, and that's obviously not a human rights community, but it's an economic interest, and it affected a lot of workers, mobilized very quickly, got on the phones, sent out letters, emails, but literally to everyone, because no one knew what the decision was going to be made. So I think that regardless of whether the ground rules change, the same tools apply, that it's reach out to people you've built relationships with, mobilize as a community. As other speakers spoke to, I think we learned from this pandemic that we exacerbate existing divisions and differences, whether they're racial, whether they're economic, whether they're regional, cultural, language barriers. We dealt with a lot of interesting workers' rights concerns about making sure that our first responders who had to continue to go out there, you think about your firefighters, your emergency medical personnel, your police officers, who, when we didn't know how this thing spread, still had to have human interactions, whether they're dealing with if they were taking a domestic violence calls, we talked about the plight of women in this situation, or if they had to break up a fight in the street or any sort of thing like that. And what we discovered in our locality was that we fixed the rule successfully because we got the advocacy from this community, but you would have had to prove somehow that you had gotten this awful virus in the line of duty, and it's still almost impossible to figure out when you actually get this virus. Same thing though for people who operate retail stores or any forward-facing environment. We have to make sure that if they're forced to leave the workplace, that their material needs are still being met, and I think that's really important. One last thing that I thought was really important on that is I think this crisis had taught us that whether we're dealing with this pandemic or whether it's a future natural disaster or a war or something awful. It's how to quickly scale up services, whether we're a nonprofit, whether we're like, you go from one day where there's, you know, a set number of people who need your help. And we saw, like, for instance, with our unemployment system, that we needed 10 times as, there were 10 times as many people needing to apply overnight. And we were not capable of catching up. And as a result, there was very real human suffering. And that was not intentional. That was just a neglect of putting resources into these systems, because nobody wants to spend money on administrative stuff. Nobody wants to spend money on process stuff. But human needs can't be met if there isn't the human capital, if there isn't the talent, if there isn't the digital infrastructure, if there isn't the training. And I think I'd be remiss if I didn't mention, if we're talking about human rights, that in the United States, we still had the opportunity to really finally continue to address issues with police brutality against communities of color. Even though there was a global pandemic that shut everything down, we saw a lot of incredible activism by the Black Lives Matter movement, the Justice for George Floyd movement. And I think that's compelling for two reasons. One, because it's a reminder that regardless of a pandemic blocking out every kind of communication possible, we can still push forward important human rights issues. And it was also a reminder that even in a pandemic being shut down, that this issue still happened. There was still this violence. And I think we can't, but the other piece is that the pandemic exacerbated that division. So it was almost like enough is enough. We saw everything else in the world had halted, and yet there was still young or Black men and Black women still being killed in the street by bad police. And so there was a line that was drawn, and people had the opportunity to make a stand there. And I think the last piece for all of this discussion is we can't hide behind turf battles anymore, whether we're talking about that piece or the stuff I talked about in the beginning of this. All government, all nonprofits, all transnational organizations need to work together to find solutions. And that's why the forums like that the GP Kerala Foundation puts together are so important. And I think, I'll close with this. This quote really struck me when I had recently, at the beginning of this whole situation, I found myself reading The Plague by Camus again. And he says there's a quote that we've seen quoted a lot, but there have been as many plagues in the world as there have been wars, yet plagues and wars always find people equally unprepared. And I think that's the point, right? Is that we're in a crisis. This crisis is going to end. We are going to find a vaccine with the best and brightest minds in the world, but there will be another crisis. When we get back to the good times, or we get used to a new normal, that does not mean that there is not going to be another plague, another natural disaster, another insurrection, another war, another unexpected human rights issue on top of all of ours. So we should be almost forward thinking about both how to resolve to this crisis, but how to be more resilient for the next. And with that, thank you very much.
Thank you so much, John, for your great presentation and advices and the suggestions that you share among us. Definitely it will be an asset, and we look forward working with you together. As you said, unity, unity, unity for a better world. Next, I'd like to invite Morshid Alam, freedom fighter and first South Asian elected officials in the history of New York. Morshid Alam. Please unmute. Please unmute.
You can hear me now?
Yes. Yes.
Hello, everybody. My greetings to everyone, and I thank you, Somnath ji, for inviting me in this event. And this is a very important time and important issue you are discussing. And I thank you, all the panelists, for your valuable and very important discussion and presentation. Actually, I'm an activist, live in New York for a long time. I'm from Bangladesh originally. I came 30 years back in this country. As an activist, I have seen the human rights, how is violating by the human being. And actually, human rights is more violating at the time of COVID virus 19. We are facing a lot of discrimination and the differences between the service provided by the government to the people at the time of this pandemic situation. And my feelings is that we get to be understand each other and we get to learn what we have to do and how we can help each other in the best way. Because in this pandemic, in Bangladesh community in New York, we lost about 300 people. And because of the ignorance, because of the reason people don't listen the instruction of the health professionals, if they listen and if we listen, we could have a less problem. But sometimes we take this thing as a discrimination, that is, we are not getting service from the provider. Some of the time at the beginning of this pandemic, actually what happened, people were not, they don't have the knowledge, they don't have the understanding, they don't have the experience, so they got a problem to take the measure or the things to protect themselves. And at the same time, the discrimination came from the administration against the poor, middle class, and colored people as a whole. That's a clear violation of the human rights, because treating a different community treated in different way because of this, their economic strength or economic situation. So one thing we get to do as a community, back home or here, or all over the world, people have to stand together and fight for the rights to get their things in their way. If we don't participate in the system or the society, we'll be keeping ourselves out of our rights. So I am urging everybody to understand the situation and how to change our mind, our culture when we come and involve in a society. Because those who are immigrant in different countries, actually sometimes we try to use our own cultural background or experience in the society we live in. We get to understand and we get to follow the instruction of the government, and then this way we can be assisting the society and helping the community to establish ourselves. So I thank you everybody for listening me, and thank you for inviting me. Thank you.
Thank you so much, Morshid Alamda, for your valuable suggestion and sharing your experiences. And you are, as our great leader in our community, in South Asian community. Thanks again. And now I would like to invite Professor Kapil Shrestha, Senior Human Rights Activist and Vice President of National Election Observation Committee in Nepal.
Very good evening. Very good morning to friends. First of all, I would like to thank J.P. Kurala Foundation of the United States of America for inviting me to be part of this very important process. I feel indeed very much happy. And well, when looking at so many people, so many activists from so many countries, it reminds me of and John Bayle's song, which I have been singing since last 50 years. Where have all those and these flowers are looking very beautiful. Thank you. Congrats. So, well, you see, since last 6 and 7 months, the whole world entire world, not one country, not one society, not one part of geography. The world has been witnessing an unprecedented crisis. Well, this such crisis, humanity, civilizations have been experiencing, encountering every now and then. Socrates and Plato during those 2,400 years ago, 2,500 years ago, Buddha also 2,500 years ago used to talk about crisis. So this, we have been conducting a very important review and reflection and analysis of this crisis and its multifarious dimensions. So what should be our response to the crisis? And this crisis has exposed all our fault lines. These fault lines could be racial, ethnic, social, political, and economic. No country, no society is immune. And nobody has been able to identify or find any tablet of some magic wand to address the problems and issues raised by this crisis. And you have very correctly identified two issues as an important catchwords, some important concepts to understand this COVID-19 crisis and its impacts on society: human rights and human needs. And so, talking about the interconnectedness, talking about symbiotic link between these two important issues, human rights and human needs, what we find that even today, we still suffer from that we have not overcome that Cold War mentality. When people in the world, even academic scholars, politicians, and practitioners used to view it in a dichotomous way, that these human rights, which is normally associated with civil and political rights, and economic, social, and cultural rights, which is normally associated with human needs, are different, very fallacious, very artificial, and very self-defeating dichotomization and differencing. And so, do you hear me? Hello?
Yes, 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 go ahead, yes.
Okay. So, the whole our outlook, see, in the last 30, 40 years, now we have been trying to overcome, we have overcome a lot. We have been developing a holistic and integrated perspective to understand the linkage between human rights and human needs. That because, so as a human rights activist, as a social activist, I'm a both human rights activist and social activist. In 1991, when Nepal succeeded in overthrowing an undemocratic, authoritarian royal regime, I was one of the person who was leading that movement. And then after that overthrow, it was replaced by democratic system. And I was human rights activists like me, I was at the head again. We were able to persuade our incumbent prime minister, late Mr. Krishna Prasad Bhattarai, KP Bhattarai, to ratify most of these fundamental human rights instruments like International Covenants on Civil and Political Rights and Covenant on Economic Social, and all these things. And then we made a new journey to human rights, and that really strengthened human rights. And no matter what other regimes and what other governments try to restrict our human rights and our freedom, they have not been able to do, because of Nepal has ratified these human rights. Because human rights, you see, now it has three important characteristics which has prevented Nepal from falling into authoritarian trap so far. Maybe communist trap, maybe royalist trap, maybe some other trap. Nothing they can do. First is universality. Human rights supposes this universal unitary benchmark. One standard, no double standard. It is common standard that applies to America, that applies to UK, that applies to India, that applies to Nepal, and that applies to China as well. No country or no society has any luxury of double standard or human rights violations or granting immunity and impunity to human rights perpetrators. So actually this Universal Declaration of Human Rights in 1948 has really made a tremendous journey in human rights, and we have also started journey with that. And so human rights for us is an entitlement. Entitlement would be moral, ethical, legal. And nobody, as said earlier, has luxury or privilege to violate those rights. And human rights means rights of everybody. If Nepal government violates human rights of a poor person or a beggar in the street or somebody, Nepal's section is accountable. It's answerable to the world community, not only Nepal, not only human rights. As a human rights activist, I consider myself as a critic, a watchdog. I am not a doormat of any government, of any regime. I'm free to criticize. Human rights means freedom to think, freedom to move without permission of any government, any priest, or any seniors in my society. Well, I may have some respect, and I don't mind criticizing United States for this human rights exceptionalism. And I appreciate Black Lives Matter movement very much, and all other movements. So human rights people are not diplomats. So I don't speak language of a diplomat, and I speak language of a free mind academic, and human rights activists are also catalysts and conscience keepers. If we fail to do that, in Nepal now, see, we are experiencing tremendous human rights crisis as well. What Nepal government has been doing, not only this government, many governments, that it has been engaging in human rights duplicity and double standard. And this has really damaged Nepal's image and standing in international community. So look at, see, after 1991, and for a few years, Nepal's image was certainly high. And people all over the world, human rights people, democracy-loving people, all over the world had a lot of expectations from Nepal. Now, where is Nepal? And our government, in all political parties, including the ruling party and so-called opposition party, I'm sorry, I used to have 3-generational relationship with that party, and I do not deny that, but I must admit that even Nepali Congress doesn't give much importance to human rights. And in connivance with the so-called Communist Party of Nepal.
Please conclude in a minute.
Sure, it has formed this fallacious and good for nothing Transitional Justice Commission, which doesn't comply with international laws or international standards. And about human needs. Human needs, as I said, that there doesn't exist any artificial differences between human rights and human needs. Human rights is like this, this right to survival, this environment of survival, like free air, free water, food, shelter, medicine, which is not happening. So I don't want to, that the thing that I want to say, stress, is that this human right means basically this is the power of powerless, oppressed, marginalized, and poor people. So people who are rich, people who are very privileged are not very happy with human rights because human rights question their activity. Human rights questions the discriminatory laws, women question male behavior. And now that this COVID, we see that it is having different impacts and different experiences among different strata in society. Rich have different experience, poor have different experience. Look at Nepal. People are forced to having to eat 1 square meal a day offered by.
You get 1 minute of conclusion, please. 1 minute.
So less than 1 minute. So this kind of artificial differences confuses people. And it makes our strategy to poverty alleviation, strategy to development, strategy to human rights, and strategy to human rights ineffective and powerless. So people in Nepal, bureaucracy in particular, they are not sorry, my bureaucrat, they want to centralize power. And they want to look at human rights from convoluted perspective, which
thank you so much.
So the challenge for us is to recover our basic human rights, our basic and free access to humanness, and redeem our society, revive and rejuvenate. And so this COVID will come and go. The society has experienced many COVIDs since last many millenniums. So we should have confidence, we should have trust, and we should energize ourselves, and sharing our experience, sharing our opinion in a platform like this is also an empowering and enriching experience. Thank you.
Thank you so much, Professor Kapil Srestha, Senior Human Rights Activist of Nepal, for your sharing your experiences. And now, without any delay, we are almost running out of the time. Please focus on the topic and the time frame, please. Not more than 7 minutes allowed for the panelists. Please welcome Dimple Willabus. She is the president of StalwartsYouth.com and social activists, and she came from one of the Caribbean country, from Guyana. Please welcome Dimple Willabus.
Thank you, Sanmaji, for having me, and thanks to the GBK Foundation for the opportunity to join such a well-versed panel. First of all, I want to say that yes, I am from Georgetown, Guyana, which is in South America. I reside here in Brooklyn, New York. So definitely a pleasure for me to be here. Today, I'm going to talk from the angle and the perspective of the youth, because many times they are the silent majority. Looking at me as an example, I was born and raised in one of the most impoverished communities in Guyana. And growing up as a child, I never knew anything beyond the boundaries of where I grew up. I was always in that confined space, went to school in that space. And sometimes we are a reflection, or our community is a reflection of us, and vice versa. Meaning that many women, especially like myself, would just go to school, maybe finish middle school, barely get through high school, if any, then have kids, have a family, marry, have a family, and then just live as a housewife. For me, one of the things that changed my life was having access and opportunities. How was that? I was able to get into a school which was out of my community. And being able to enter that school, that high school, made a tremendous difference in my life. That opened so many doors and was a window into the world. It gave me the opportunity and access to a quality education that was so comprehensive that I saw beyond the scope of just what society had set up for me, which was, again, I said, being married and having children. I wanted more. Most women, like I said, would not have even a high school education. For me, I wanted more. I wanted everything. I wanted a quality education so that when I became a mother, I wanted to be able to have those great resources to pass on to my children, because I saw what opportunity and access did and does for somebody. So being an empowered youth, is so critical at that point in time when I entered the high school that I did. I had a quality education, came here to America, I was able to be the first person in my family to graduate with a master's degree in journalism. I had the privilege of working at CBS Network in the newsroom. And of course, I had the opportunity of working with some incredible people. I had the privilege of being on the Mayor de Blasio's Education Task Force here in New York City. I was the Brooklyn Borough President appointee in education. I was also the Community Education Council President. And I have nobody coming from my country with my background has ever held those positions. And for me as a woman and a woman of color and an immigrant who has an accent and who's coming from a very diverse background, I wanted to figure out how is it I can lift young people, because if we can figure out how to empower our youth, then we will have a generation of more educated, more educated, more in tune with what's happening in our community, because a lot of times that's one of the major challenges. Just to answer the topic on, or stay on the topic of how human needs are human rights, I don't think there's an or, it should be and, because they're definitely intertwined, just like most of the speakers said earlier to some degree. And being able to have the proper representation in elected office brings a piece of that, because if we have elected officials who are representing us at the table and they do not understand where we come from, because here in America, especially in New York City, it's like a melting pot. There are so many people from literally every cross section of the world that are here living. But if we were to have elected officials who look like us, and when I say look like us, women are still fighting the battle of trying to be at the table. For example, right here again in New York City, in the New York City Council, there are 12 women out of 51 who are in that's a ratio of women versus men who are in the New York City Council seat. So women also have that battle that they have to continuously fight or advocate for to be at the table, to be a part of that decision making. So there are many pieces and segments of our community, but we all come back to one, how we educated and how we empowering our youth, being civically engaged, being knowledgeable of our community, and respectfully and gracefully engaged. There are many segments of different communities. We can cut it here in America, or we can cut in Nepal, we can cut in China, we can cut in Guyana, we can cut in Argentina, wherever we live. But there's segments of our community that are very disengaged. That's the impoverished community, like I just explained, where I was from. People do not cater for those communities because, one, they're assuming that that community, which sometimes is rightfully so, they're not engaged when it comes to voting. They're not engaged when it comes to any kind of a educational background or any kind of engagement in a positive light. So they kind of push that community to the side and say, okay, let's focus on a community that is more engaged, that is middle class, that is upper class, that has money to donate, that has money to contribute. So that's what's been happening, not only, like I said, here in America or here in Brooklyn or in other parts of the world. So how do we how do we make that change? So the issue really is access and opportunity. And you're looking at somebody who's had access and opportunity. I should have probably been 15 or 16 or 17 years old, married with 10 children, which is a norm, uneducated. But today, I'm proud to say, not only am I an educated mother and wife of 3, but I'm also one of those people who believe in not just talking the talk, but walking the walk, because I'm also running for New York City Council in my district. Yes, I'm the first woman to do this in my district if I were to win, because it's always been held by men. I have nothing against men, but this is just the ratio of how women also have to fight the challenges and battles of being included or being at the table. So there are many scopes of how we can look at human needs or human rights. And again, it comes back to our youth. How are we empowering our youth? Today, which you notice at the bottom of my name, it says the stalwart youth. So being a child who was disenfranchised and felt, the need to not necessarily go or be motivated because my community did not say anything that deal with motivated or empowerment. But being able to have the access and opportunity to go out to get an quality education, I wanted to make sure I bring that in my home too. So how do we start by empowering our community? How do we start by empowering our country? We start with that at home. Charity begins at home. So for me, being a child who was disenfranchised, I wanted to make sure my children are empowered and were empowered. My eldest child will be 27 next month. She's an educated person who's working her master's degree, and she's a teacher by profession. My second child is 13, who's a 4 times published author, the youngest author in US history to publish a chapter book at 8 years old. And my son is 10 years old. He's still a work in progress. But my point to you is charity begins at home. We look at the society as an overall view, from a very holistic view, but it really has to come back to the home and what we teach. And a lot of times, again, it comes back to access and opportunity. If we have to eat just salt and rice, we need to figure out when we're eating salt and rice to figure out, okay, we're thankful for this opportunity here, but how do we get to the next phase as a family in our home, even if we're a single parent mother, even if we're in a nuclear family? These are things we still have to work on as a home, because being in a home, then we become a society, or a community, then a society. So this holistic thing we look at in terms of, segments of our community where we disenfranchise, we have to figure out, okay, we're a community that is disenfranchised. How do we change the scope? Maybe we need to be able to come together as a one voice to say, hey, we need our roads paved. We need to have phones in our community. We need to have water in our community. But we cannot do this alone. We have to do this as a collective body. And as a collective body, that's how we have a voice. For me, like I said, we 5 years ago, my 13-year-old daughter and I, back then she was 9 years old, 8 going to 9, we founded an organization called the Stalwarts Youth. The Stalwarts Youth was set up to empower young people, especially children who were disenfranchised and from the socioeconomic background that is not of any kind of access and opportunity communities, to give them, go to them, read books, give them books, provide them with literacy-based initiatives and opportunities so that they can be empowered. And 5 years later, fast forward, it has been so impactful that the Stalwarts Youth has done so much work, not only here in Brooklyn or in New York City, locally, nationally, and internationally. It's been a household name and brand because we've worked with children in every segment of the community. But one thing I'll tell you is that youth programs, a lot of people talk about youth, even elected officials talk a lot about youth. But how many of them are really caring enough to promote literacy? How many of them are really going to promote on the side without just being on a debater or being put on the spot to talk about the youth? A lot of them are just pushing agendas that are just in keeping with getting elected the next time around. It's for us as the citizens and stakeholders in our community to hold them accountable, to say, hey, we want to make sure our youth are empowered. And there was a speaker earlier who mentioned about schooling in terms of children having going remotely or going back in person. And yes, like I said, I was the president for the Community Education Council, which I work hand in hand with not only the New York City Chancellor, but the superintendents and all the principals of schools. And I can tell you firsthand, when I was in that capacity, that the New York City schools, the Department of Education schools, were not prepared for what just happened with the pandemic. So they were scruffling to try to figure things out. But at the same time, opportunity and access. There are schools that were private schools or independent schools or other types of schools that the children did not suffer in the way of being able to adapt, because those children were able to have opportunity to use a computer, use technology to access their resources. So when they were home, it was a smooth transition to some degree. So just to retract, in terms of human needs and human rights, it's incumbent upon each and every one of us to take on the task to accept where I stand as a mother or a wife or a man or what your position is, a woman, a child, whatever it is. Say, this is where I stand and this is where I'd like to be. How am I going to work towards getting to the next level? How do I get people who share my sentiments to work together with me so we can be able to advocate, to call for this, to ask for this, and do it in a respectful manner? It don't have to be in a protest form, because I want to ask the question, and this is up in the air. This is a rhetorical question. How many protests has really led to actually changes in our community. It make the news, it makes social media, because everybody can use a camera and phone and just go on social media. But how many of those changes were actually infected in terms of policies and laws that are actually positive? Not a whole lot. I mean, there's so much more room for growth, and we can talk all day on these different subjects and topics. But more importantly is how we can do it in a respectful manner, and being at a table and being a stakeholder who understand your position, and being in a room and being at a table to make those decisions are the most impactful of all. So I'll close there. Thank you.
Thank you so much, Dimple Ularos, for your valuable inputs. Next, I would like to invite Ms. Bharati Silwalgiri, the advocate of global gender equality, and the founder member of the Human Rights Organization of Nepal. Bharati Silwalgiri.
Namaste, everybody. I would like to express my thanks and appreciation to the GPK Foundation for including me in this important talk series. Today's topic is especially relevant, I feel, given the urgency to deal with the spread of COVID-19. It is an unprecedented development in which a tiny invisible virus has taken the world by storm, and even the most strongest countries in the world, in terms of military prowess, are literally powerless to combat this infection. It is not only ironical, but also humbling that this tiny invisible virus has affected all sectors of the society. And more than ever today, the core values and principles of human rights and democracy are at stake because they are interlinked, indivisible, and interdependent. Therefore, Somji, in responding to your question as to what approaches can be taken to implement the COVID-19 regulation in international human rights law, first of all, I would like to point out that since the history of development, the world has experimented with various approaches, from welfare in the 1950s to equity, anti-poverty strategies to efficiency approaches. Soon it became obvious that those who needed it most were being marginalized through the trickle-down effect, as the real benefits of development did not reach the needy, especially the poor and the women. The issues of inequity, inequality, and discrimination remained largely unaddressed. Thus, gender mainstreaming and empowerment approaches have come to stay, as it shines the light on patriarchy that suppresses and oppresses not only girls and women, but also poor men, Dalits, ethnic, religious, and sexual minorities, and people with disabilities who have been made weak and poor in a hegemonic society, to ensure that policymakers not only pay attention to gender equality and social inclusion, but pay equal attention to participation and rights of all men, women, and minorities, irrespective of their sex, gender, class, caste, age, creed, location, and language. Now, inattention to particular rights of the oppressed in the international human rights discourse has resulted in neglect and pervasive denial of their rights. Therefore, specific international human rights instruments that focus on women, children, people with disabilities, and racial discrimination have been passed by the UN, to which signatory countries are obliged to implement and report on the progress made in their implementation periodically. As W.E.B. Du Bois, the first African-American sociologist who developed the critical race theory, challenged that race is not a biological construct, but a social construct, which also resonates with feminism, points out that although everyone is equal in the eyes of the law, the justice system, which is supposed to mete out justice to the Black people, punishes them. Now replace Black with women or any other oppressed and marginalized group. Punitive justice does not safeguard or promote rights, as we can observe in what is happening in America today. Black lives matter in a white supremacist culture. nor does it safeguard the rights of women and other oppressed groups in a world that is essentially patriarchal. Therefore, unless a rights-based approach is willfully implemented and governments are held accountable as per the normative framework of universal human rights, the COVID-19 will rage on. And here, I would like to mention that because everyone does not start out on an equal footing in life, equity is an important measure in ensuring that those who have less are given more to level the playing field. That is why in domestic contexts, and in my case, Nepal, the main challenges in implementing international human rights law and relevant guidelines are myriad and at multiple levels. But the main challenges lie in the political will, honesty, and vision of the political parties, whether they are in the government or in the opposition. In Nepal, at the moment, as the COVID-19 cases spike on, the ruling party is heavily embroiled in its internal politics of self-aggrandizement. The greed is obvious that in order to wrestle power from each other, the issue of COVID-19 has been sidelined, with lockdowns being seen as a viable strategy to contain it. And sadly, the main opposition party has not played the role of an effective shadow government and also remains occupied with its internal power tussle. The coronavirus has proved more resilient, and now Nepal has entered beyond the fourth stage of the pandemic. Now, while health is of utmost importance, which Bandana has dealt with at length, the immediate fallout of the lockdown has been on the economy. The impact I see is fivefold. One, drop in exports and aggregate demand in the manufacturing and service industries, including the construction sector, affecting wage growth. Wage laborers have been the hardest hit. The pandemic has also disproportionately impacted women who work in the informal sector and as home-based workers. Number two, downturn in internal and external migration, depleting the income capacities of individuals and countries in the form of remittances, especially straining the financial capacity of a remittance-dependent country like Nepal. At the individual country, returnee migrants in Nepal are being targeted for bringing in COVID-19. The third, as I see, is failing financial liquidity owing to shrinking national budgets in the absence of revenue collection, as industries and manufacturing services have been grinded to a halt. The fourth impact is increased corruption and bad governance in the purchase of medical supplies without observing due diligence. Although the government has reported that it has spent more than 10 billion rupees to prevent and contain the spread of coronavirus in the country, including in setting up quarantine facilities, importing health equipment, and distributing relief materials, adherence to WHO protocols and standards are still a far cry. Instead of having empathy, as Brahmananda mentioned some time back, and instead of having empathy for those who have no means of survival, the distribution of relief packages was seen as vote banks and nepotism was rife. The fifth impact that I see, and this has exacerbated the vulnerability of men, women, particularly the poor and excluded women, to extortion, exploitation, including sexual abuse and trafficking, again, as Brahmananda said, thus marginalizing them further. The lockdowns have aggravated this situation, especially among those who have lost their livelihoods and income, with men turning to alcohol and wife battering to vent their frustrations and anxiety. Also, the lockdowns has increased the unpaid work, care work, and domestic work burden of women, and they have been forced to tolerate domestic violence, leading to increased levels of stress and desperation. Attempted suicides and suicides have increased drastically in the lockdown period, and data indicate that the number of suicides committed during the lockdown period far exceed the number of COVID deaths in Nepal. Actually, the number of COVID deaths in Nepal as it stands today is 336, and deaths by suicide is 2,218. Now, Nepal has laws on equality and non-discrimination. In fact, the 2015 Constitution envisions a society based on equality and non-discrimination. However, these are just hollow words, as in a highly stratified society with patriarchal values and social norms, gender inequality and discrimination remain entrenched, which is expected to further deepen in the COVID-19 crisis. Now, this is definitely going to create more inequalities and poverty, affecting the achievement of the SDGs by 2030, and particularly the SDG 5 on gender equality and women's empowerment. Thank you.
Thank you so much, Ms. Bharati Silwalgiri, for your wonderful presentation, focusing on the topic provided, human needs or human rights. We look forward working with you and we definitely need your ideas, support, and feedback on our movement ahead for the new world of coming new world in new normal. Thanks again. Now, without any delay, I would like to invite Sumitra Magrati. She is also the youth activist of marginalized community and co-initiator of Dalit Dignity First. Sumitra Magrati. Please welcome Sumitra Magrati.
Namaste everyone, Honorable Sujata Koyala ma'am and distinguished panelists. Thankful to GP Koyala Foundation for taking this initiation, and thank you so much, Jivire sir, for providing me an opportunity. I'm extremely honored to be here today. I am co-initiator of Dalit Dignity First. Dalit Dignity First is a campaign which main objective is to engage the Dalit and non-Dalit youth in the same ground to empower and to develop networks for the progress of the individual, community, and nation. So today I will deal this topic as an activist point of view. So human needs are universal, and COVID-19 has brought about unprecedented financial insecurity globally, up to the verge of having difficulty with fulfilling our basic needs. And the most basic needs are physiological, are at requirement of human survival, including health, food, water, shelter, which are primarily essential and non-negotiable. However, amidst crisis, majority of population are needing holistic support from the system to fulfill these needs. The vulnerability and the lack of support means they are responsible to the governing bodies they reside with. All the systematic bodies responsible for planning and policies that are obliged to address the need of the common people with where possibilities of employment and self-sustainability is minimal. And there comes under their economic, social, and cultural rights. In need-based approach, vulnerability is addressed as the symptoms of poverty and marginalization, whereas in right-based approach, vulnerability is seen as a structural issue, both caused by and leading to unequal power relations in society. The right-based approach is a broader concept, although right exists as a legal entitlement. People still suffer from poverty, unemployment, hunger, and unequal access to health and education. But everyone is equally entitled to human rights without the existence of discrimination. Globally, there was a notable in a racially motivated discrimination and attacks because of COVID-19, particularly but not exclusively against people of African descent. And there is notable rise in xenophobia, while supremacist, casteism, anti-migrant hate speech, and conspiracy theories amidst pandemic. In my country, Nepal, there is various issues arising and it's worsening with each day regarding economy, cultural, and social, leading towards the hate speech, discrimination, violence, even leading to death. Marginalized communities of Sarai belonging to Dalit community are among those who are suffering visibly. Statistically, 14 deaths have occurred since the beginning of lockdown in the country. and all resulting from violence and discrimination from their community by so-called upper class society. Besides, discrimination against frontliners, health workers, Dalits, gender-based violence are some of the major issues on today's amidst novel COVID-19. In dealing with the issue of COVID-19, it has addressed that internationally by naming pandemic. And developing country like Nepal, it is pandemic, which is a poverty plus pandemic. We can use two approaches that can be taken to implement COVID regulation in the international human rights law. The first one is public health approaches. It includes awareness, safety, and every marginalized group should be provided healthcare. And second one is global awareness, global ownership. We all are in the same boat. If any country that makes vaccines, that should be free cost. As global ownership contains 4A and 3D. 4A means availability, affordable, accessible, and attainable, whereas 3D means no delay in seeking care, reaching care, and getting treatment. In domestic context, the main challenges in implementing international human rights and relevant guidelines are cultural relativism. And another one is exercising the power, but there is no justice. And another one is majority in politics. By legislation of equality and anti-discrimination law, the implementation of policy at the national level will strengthen by following policies. First, we should know the grassroots. There should be the cultural transformation, knowledge transformation, and education transformation. There should be a true consciousness and positive discrimination. There should not be discrimination on the ground of caste, religion, gender, class, race, and other physical attributes. In combating hate and discrimination, the policy and practices that can be pursued are hate and discrimination are emotional law, and regular law can't regulate it. It's defined by practicing more than law. Most importantly, there should be a holistic model, overall societal transformation. The legislation should make policy a protocol, then and the related authorities, media, civil society organization, government, business should integrate strategically with the same motto by using different tools. For instance, advocacy, media, and many more. The measures that can be taken to prevent the hate and discrimination in the social media and the internet are to protect victims in the context of ICTR. The first one is legal enforcement, that means cyber law. Second, content moderation, and third one is education and awareness. Education and awareness is the main thing to prevent hate and discrimination. To improve, I'd like to conclude it. To improve, in this crucial period, rights of every individual must be crucial concern and priority of the nation. This atrocities and discrimination must be addressed through law of enforcement. Preventive measures must be applied and continuous support to deal with the cause of discrimination to balance the power between authorities and vulnerable groups, rather than fulfilling the need of addressing the symptoms of discrimination. Thank you.
Thank you so much for your presentation of rights of the Dalit community, and you are also the co-initiator of Dalit Dignity First. So again, like I said, we all work together for the better world ahead, and we are with you. Okay, thank you. And without any delay, I will invite Kebal Singh Rathod, who is attorney at law and national convener from India of Samajik Ekta Jagruti Mission. Kebal Singh Rathod. Yeah, cannot hear you. Hello? Kebal Singh ji cannot hear you. Rathod ji cannot hear you. No sound. Hello? Yes. Please unmute, please unmute. Please unmute. Yes, go ahead.
It is my pleasure to be the part of the most significant virtual conference organized by Girija Prasad Koirala Foundation. I am grateful that I am discussing with world's most intelligent persons who are tirelessly working for the underprivileged society. COVID-19 pandemic is a very worst situation, and it was a very critical time for the all countries and all the societies across the world. And after the COVID-19, there are lots of problems and difficulties are facing the peoples across the world. One of the most problem is the unemployment. Actually, I am belong from the India, so I would like to describe about Indian people and Indian society. So, as per the government data and the official data, that after the COVID-19 situation, approximately 130 million Indians lost their jobs. So job loss is a very great impact over the people of India, and the most of industries and corporate sectors paying less salaries to their employees after the COVID-19. And the problem of the government is that government changed their law and their relief to the corporate sector, to the factories. The factories, the labor law and other related laws will not imposed properly. So the COVID-19 situation is a very worst situation for the working class people. And the government of India applied World Bank for the loan, and the directors of World Bank are ready to pay $2 billion loan to the India, and they released $1 billion on April 2nd for the welfare of the people who are affected due to COVID-19 situation, due to COVID-19 pandemic. And it was the name of India's Social Protection Response Program, and the government of India assuring to the World Bank that the government will start Pradhan Mantri Garib Kalyan Yojana for the people of India who are affected for the COVID-19, means marginalized people, working class peoples who are patient of the COVID-19. But government did not apply the Pradhan Mantri Garib Kalyan Yojana, or did not pay any rupees to the weaker section people who are marginalized people as the relief fund. And the COVID-19 situation is a very dangerous situation for the people who are working class society, who are underprivileged people, because the rich people and super rich people are getting treatment at the private hospitals in India. The hospital facilities in India, there are two types of hospital facilities. Private hospitals are giving good services, and the government hospitals and the public health centers are in a bad situation, and they are not giving good facilities or good healthcare facilities. There are many hospitals in India, mostly in the rural sector. There are no ventilator facilities. There are no available the vaccines or anything, medication related to the any disease. So COVID-19 pandemic is a very worst for the weaker section people, and social protection is a critical investment since the half of India's population earn less than $3 per day. So Indian people, mostly the 50% of Indians are earning below $3 per day. So India is a very poor country rather than the other developed country like USA or USA and United Kingdom. So over the 50% people are earning less than $3 per day, but government is not using a proper action to uplift the people's lives due to COVID-19. And the main problem is the education system is totally collapsed due to COVID-19. Only 5% students are getting online classes, but 95% students are belong from the poor section, have no any facilities of the equipment of the online classes. So they are not getting the online study. Schools and colleges are closed and they have no any other equipment to get the online classes. And in India, the COVID-19 situation is a very high. India is the second largest dangerous country in world. That per day more than 19,000 cases are positive due to the testing. So India education system totally affected. Then after the government is totally ready for the exam of JEE and NEET. The students are demanding to stand over the exam or postpone the exam for time being, but government is not ready to postpone the exam, and the government is not taking proper action for the migrant people's children. More than many people are migrant workers and their human rights are violated. As per the government official data, more than 20 crores people migrate from their job place to their hometown, their native place, but they don't get proper medication facility, proper shelter facilities. Many get abused and domestic violence, and the problem was many for the weaker section people. And the third thing is health facilities in India is a very weak. Mostly the weaker section people who are suffering from the COVID-19, they are not getting proper healthcare facilities. It is a one type of violence and one kind of the violence of human right also, because the rich people and government officials and the politicians are getting a perfect treatment at private hospitals and other hospitals, but the poor people not getting even a bed in hospitals in India. So it is a very difficult situation for the poor people. There are no any law and order maintained due to the lockdown. The lockdown was the mismanagement of the government. There were no any planning of the government for the lockdown. Due to the lockdown, millions of people disturbed their life in India because they have no any foods, they have no any money, they have no any medication facilities at their home. And the government
1 minute, please.
Government suddenly announced the lockdown. And in India, mostly I would like to inform about the Disaster Management Act 2005. the Disaster Management Act 2005 is related to the disaster and the natural collapse or any other related things. The government of India imposed the lockdown on the name of Disaster Management Act. There are three types of body in Disaster Management Act. One is the central government central committee. Second is the state government state
Please
committee.
conclude
And
in 30
third is the
seconds.
committee. But government used their powers only, but they denied their duty as per the Disaster Management Act, and more than 250 million workers migrate due to the lockdown. So government should proper implementation of the Disaster Management Act. It is my suggestion to the government. And
Thank you very much.
And, actually, I know that it is a very short of the time.
Yeah.
But India is the second largest dangerous country and government. And
Okay, thank you very much. We will keep in touch together. We work together in soon. There is no time. We have 10 minutes left. There is a question session and there is another speaker too. Thank you very much for Kebal Singh Rathod ji. We'll keep working together.
Okay.
Now, without any delay, I would invite the last panelist of this Zoom conference, DP Kafle, General Secretary of People's Forum for Human Rights from Bhutan. DP Kafle.
Thank you very much, Somji. Actually, human needs means three things.
Kafle ji, namaste.
Namaste.
I cannot see you. Please put your video on.
Yeah, my video is on.
Okay.
Can you see me?
Yes.
Okay. Human needs means food, shelter, food, clothes, and shelter. So it is correlated to human rights. COVID-19 has impacted the rights of the person because people, there is restriction on travel as well as freedom of speech and freedom of education, freedom of religion. Everything is restricted due to in the name of COVID-19. So human rights is also totally violated the rights of the people. So you are not getting the proper justice. Like, let me take one example. The champion of human rights are the violator of human rights in the name of COVID-19. It is very simple to show the dustbin. If you are asking why these rights are violated, then it is very simple that they will show due to the COVID-19, these rights are violated. A person traveling from one place to another have their obstacle in transit, showing the case of COVID-19, because most people traveling from Nepal or India or Bhutan, like in their transit, they are asked for different things which was not asked before, like transit visa and other things, where they are delayed and are asked to cut another ticket. So it is very much depressive by the discriminatory system of any airlines or the government. So government should be equal to all the people, because the people are the citizen of that particular country. And even we should obey the international norms of human rights in any sector of the things. So what I suggest is that to fight against all the discriminatory law of a country and other things. If you get your rights in a proper way, that's okay, fine. If you are not getting any your rights to be preserved, so we should unite together. The human rights activists should unite together and fight for have the common agenda and fight for the rights. So, as you know, friends, human rights doesn't have boundary. Though the country has their boundary, this much is our portion, this much is our portion, but human rights, we don't have any boundaries. Any human rights activist can just plead for other human rights activists of any other countries. So I don't want to take much time, because most of our previous speakers, they have just spoken on everything. So I'm with this panel, and I only request this panel, unity is the strength. So let's come together and work for future action. Thank you very much, Somji. Hello.
Yes, thank you very much, DJ Kapliji, for your very short and sweet, precise to the topic of human rights and human needs for your presentation. Thank you again. And now we concluded this session with a presentation of the panelists, respective panelists. Thank you all, the respective panelists who have joined for this 13th series of global Zoom conference. Which we also, our chairperson, Honorable Sujata Koirala, she named this Zoom conference as a GPKF 3I, that is GPKF International Intellectuals Institution, virtually, so that all of our programs, all of our series that we have been running, this is our 13th series, and it will convert it into ebook, which we will definitely store in our library for the generation to come and learn from all the expertise that expertise presentation in here. And also we are building our app, GPKF app, and this will also go soon on the smartphones. So now we move on to the second session of 10 minutes. There is the first question. One of our viewers asked to Viviana Christie-Civic, should human rights be seen as a special type of human needs when it comes to freedom?
I will have to think about it. I think that many aspects of freedom are actually protected by human rights. So my response would be that yes, that many positive and negative freedoms are protected by core human rights. I think the main question comes to the point where those freedoms can intersect with the rights of others, or when those freedoms, in order to be exercised, they need of resources that should come from the state or that should be distributed so as to make it possible. And that's where different nations and thinkers have found a different way of approaching rights. I think that from many of us close to the fights for equality and there's a push for a recognition of a broader set of accessing basic needs as protected by rights. For example, a right to health, which in the US is not as well protected, or right to water, or which has been recognized by the UN, but in many countries is still not secure properly, or an incipient right to access to the internet, for example, which has been brought up now more prominently as well in the context of COVID.
Thank you so much, Viviana, for your answer. I hope the audience who asked this questions should get it. So now, next question I have for Bharati Silwalgiri. Is she there? Hello.
Please go ahead.
Oh, okay. So one of our viewers, as we are on live, on the social media, when it comes to gender equality in Nepal, why marginalized community are suppressed as the world is moving ahead?
Thank you for this very important question. As I had mentioned in my earlier in my presentation, the marginalized groups have been suppressed and oppressed because of the stratification in the society that is upheld by patriarchal values and social norms, which again is upheld by religion. And therefore, it is up to the marginalized groups and the women to recognize that. I had mentioned W.E.B. Du Bois, the first African-American sociologist who developed the critical race theory. And he talks of double consciousness. That double consciousness is, one, is how we see ourselves through the eyes of the dominated. And when we see ourselves through the eyes of the dominated, we try to mimic their values, their way of life, their way of thinking, without realizing that once we look at ourselves through their eyes, we oppress ourselves and we suppress ourselves. That is why, and even Marx said himself, that the false consciousness is that the dominated always looks up to the one who is dominating. And then we ourselves internalize those values of discrimination and inequality. For example, if you look at the Dalits group, and that is a kind of a Damocles sword. One is the gender and the other is the caste dimension. Within the Dalit groups even, the women are the most dominated and the most discriminated because they imbibe the values, the patriarchal values and the social norms, which again are upheld by religion. Because in our Hindu religion, what does it say when a bride is given away in marriage? It says, Mare pap pale punya, which literally means if you look after your wife, you will get a seat in heaven. If you kill her, it will be a sin. And that is how domestic violence has been perpetuated, because religion accepts that women can be beaten up, women can be done anything at the whim of men, of hegemonic men, mind you, hegemonic patriarchal men. And that is why the marginalized groups, which also includes women, are further marginalized. Thank you.
Thank you so much, Bharati Silwalgiri, for that critical questions and right answer. I believe the viewers got the answer. Again, now there is another question for John Mulholland Jr., attorney at law. Should human rights be seen as a special type of human needs? Do US need another Martin Luther Jr. King?
I think to the first question, I think human rights are in fact a human need, and without human rights, you can't adequately explain what you need. I mean, our rights allow us to petition our government, allow us to engage in all kinds of both positive and negative freedoms, like we spoke about earlier, having your healthcare needs met, having your basic needs met, having your needs for community, your need for artistic expression, all of those sorts of things. And I to the second question, I certainly don't want to minimize any of the existing leadership going on right now in these important social justice movements. And to the answer, though, it would what Dr. King was able to bring is a level of moral clarity, which again, I think is still happening. He was able to call out hypocrisy and was willing to take controversial stances. And I think there's a tragedy in a modern American history as we sort of sanitize his activism and make it seem as though it was always just to sort of get along and be peaceful piece of it. Of course, he was nonviolent and was in a long line of history of advocacy of nonviolence, but he was not afraid to call out injustice anywhere he saw it. He was not afraid to denounce American international intervention. So to the answer is that I don't know if we need another person to fill that role, but we need people to have that sort of moral clarity, a willingness to call out institutions when it needs to be done, a willingness both to compromise, but a willingness not to create false equivalencies. And that was also something that Dr. King was very clear about, is that we talk about, like, in America, we've gotten so fixated on the destruction of property as if that's somehow an appropriate equivalency to the loss of human life. And Dr. King never tolerated that, and we can't tolerate that.
Thank you, John, for answering that question. I hope our viewers who got that answer. Thanks again. And if there is any more questions, we'll get back to you. We have like 10 minutes of our time left. Next question, there is a next question we have for Dr. Uzma Gul. Dr. Uzma Gul, are you there? Please unmute. As you are a United Nations Youth Ambassador, what is your future vision on promoting human rights on youth in Pakistan? Dr. Uzma Gul. I hope she, okay, I'll get back to her. Hello, Uzma Gul, are you there? Okay. So next, I have the question for Brahmananda Singh.
Sorry, there was some network issue out there. Can you repeat the question, please?
As a United Nations Youth Ambassador, what is your future vision on promoting human rights on youths in Pakistan?
So we are actually in contact with all the youth organizations currently working in Pakistan for now, and not only in Pakistan but Asia Pacific region, because formerly I was attached with Commonwealth as Asia Pacific head, so I was in contact with all the youth ambassadors and all the youth activists who were working in Asia Pacific region. So I am actually giving a proposal to UN and the international agencies that we can collaborate and we can organize some online sessions regarding this, so we can hire or we can invite people who are experienced in human rights and who are activists like Brahmanand Singh Saab and all the prestigious honorable guests here. So we can invite all of them on our panel discussion. So when the vision and the mission is transferred till the grassroots, only then we can change and we can contribute to the human rights and human needs in the country. So I think after the civil societies have done their work, only after that the governments will understand the importance and then they will be mobilized, because without that we cannot just keep on banging the door of the governments, because they don't pay heed to any issue regarding youth and women in my country especially.
Thank you so much, Dr. Uzma Gul, for your answer. Next question I have for Brahmananda Singh Ji. I heard one of our viewers just wrote me in the chat. I heard that you made a movie or film on human trafficking. So will you have any future plan or any in your mind that you will make such a movie in as regard to this topic today, human needs or human rights?
Well, it's an awfully interesting subject to explore, and I think you people are
Cannot hear you. A little bit louder.
okay. Can you hear me now?
Yeah.
Okay. So I'm saying that it's an amazingly powerful subject. And you people have explored it so well that I am excited. I made that film on human trafficking and child labor because it impacts 150 million children. And childhood lost is one of my fundamental rights. That you have a right to your childhood, you can't miss. And in the same way, the right to freedom, the connect between the rights and the needs has to be understood very, very well. And I think no better medium than cinema to take this to millions of people. I think right in the beginning, when Sujata ma'am talked about Maslow's pyramid, you know, of the basic needs up to self-actualization, I think that we need to understand that in an experiential kind of a way, much more than just theory, because it's a very, very powerful pyramid and a theory. And I think the moment we start seeing its practical repercussion, its practical relevance, and start addressing them, I think that is when the change will probably start happening. And yes, I am quite excited. I can take it up as a subject backdrop to explore a story, about this, the connect between needs and rights. To me, needs, rights, freedom, responsibility, these four things combine in a very, very powerful way for any human being to lead a fulfilling and meaningful life. And I think the more we create awareness for that, the more, because it's not just one-sided. There are many people who understand their rights, but they don't understand their responsibility at the same time. With freedom comes responsibility, with rights comes responsibilities. So I think if we understand that they are part of the same jigsaw, then the puzzle starts making sense and fitting in somewhere. But yes, to answer your question in short, it's a brilliant subject backdrop to explore an idea.
Thank you so much, Brown and Singh ji, for answering that questions. And like you said, it is a very sensitive and powerful, will be if you plan to go ahead. And definitely, I think we will work on it and do something for, better of the world, a new world for the generations to come. Thanks again.
And I would be very happy to join hands, because I think a filmmaker in isolation can't do much. They can do only a limited, but it needs, like the film that I have made. I made the film, but that was only 50% of my mission. The actual fun and pleasure lies in the places that is being shown. The traffickers are being identified, traffickers are being caught, various platforms starting from UNICEF and others. The film is being shown, it's being debated, and action is being planned. So it works as a beautiful trigger, and then it has to be converted into actual action, which is where Dr. Uzma and others, come into play.
Thank you. Next, I have a question for Sumitra Magrati. Are you there? Sumitra Magrati.
Yes, sir.
As you are a co-initiator of Dalit Dignity First, so when you look at the history of marginalized community rights in 10 years, in 10 years, what do you see at your viewpoint or at your eye? How you see it before 10 years and now? This is the question asked by one of marginalized community, member of one of the marginalized community from the Dalit Dignity First. So how you see the rights are moving ahead or not.
Okay, thank you so much for questions. Before 10 years, the condition was really vulnerable. There was no reservation system, and people are not getting any facilities. And now there is there is a big change, because of reservation system also. The Dalit community getting the opportunities and getting the opportunities in different sectors. And now,
Hello, are you there?
and now things are changing, as Dalit communities people are also doing great in different fields. And I'm hopeful that one day there will be equality, and there won't need of reservation system and any other things. Thank you.
Thank you, Sumitra Marathi for your answer. Now I have a question for DP Kafle.
Yeah, I'm here.
Okay, how do you see now, and when relate to Bhutan democracy and human rights issues? I believe one of the viewers from Bhutan, he's from Bhutan, he says, but he's residing in Pennsylvania. Don't you think the human needs are highly protected than human rights in Bhutan by the government?
Actually, you see, I'm an asylum seeker in Nepal. I left Bhutan in 1989. So now I'm in Nepal, and presently I'm in Canada, stuck due to the lockdown in Nepal. So you see, there is, though there is the change in the system, means that they have just announced two-party system in Bhutan, but which is not fair. Human needs are there because Southern Bhutanese are not very much perfect for the prime ministership. Even all the time, 3 or 4 elections had been passed. All the time, the northern people are in the prime ministership. So there is no proper law, no proper guidance, no proper constitution in Bhutan. So we don't see that there is without discrimination in everything.
Thank you, thank you. This is the final questions for Viviana Christie Civic again. Like you mentioned earlier, in Argentina, human rights are protected in the constitution. But when we see the news and read about the Argentina human rights, this is not exactly as it is in constitution protection.
Yes, I think that we can say that about all of the countries that I work on. There's always a gap between the constitutional promises and the realities. I think that in the case of Argentina, we're closer to some of our basic promises than in some other countries, but there's still a ways to go. There's still a ways to go. And I think one important thing in Latin America that has come from the transition to democracy has been that many of the constitutions have these clauses that incorporate not only some of the promises that traditionally are in many of the constitutions, but also international treaties. And in that way, it expands some of the rights that are protecting under the constitutions. I find my one of my hopes in the South African Constitution, which I think it's a beautiful, beautiful instrument that also has important tools for protecting and promoting human rights. And I think that many Latin American constitutions as well have institutional guarantees for the protection of rights. So, but yes, there are many problems in Latin America, including in my home country. And I now live in the US. And so this is also a country where there are systemic problems.
Thank you so much for all our respected panelists, those who joined this very important series of GPK Foundation International Intellectual Institutions virtually, of course, in this pandemic time in the COVID-19. And this is our 13th global conference via Zoom. I announced that we conclude this 13th series today successfully, and like I said again, we are in process of making e-books of all our series that we do. This is 13th one, and we continue doing every week, once a week, and we will update you whatever it comes. And again, you can always visit our Facebook page for our updates, GPK Foundation. And there is always, all the activities are updated. And even you can visit our website, www.gpkf.org.np. So thanks again for all our respected panelists who joined this institution, I call it institution that we started, and share your valuable experiences, ideas, and opinions. And again, hope the global citizens will definitely gain knowledge from your point of expertise you are in the field of human rights, and scientists like film maker, movie maker. So this all like a process of learning. Let us learn and teach for better world in post-COVID-19. Again, finally, I'd like to conclude your remarks by if you have some remarks in 30 seconds, starting from Bharati Silvalgiri.
Somuji, I will not take much of the time because we've already, I think, overstepped the time. But thank you very much. I really gained a lot of knowledge and understanding from the experiences and knowledge from all the distinguished panelists. And to Brahmananda ji, I wish you all the best. I hope you will make a movie on trafficking. And I would like to let you know that I am the chair of the National Network Against Girls Trafficking in Nepal. So if there is anything in any way we can collaborate, I'd be most happy to do so. And I hope we all meet again, and a lot of appreciation and deep gratitude to Somnath ji and to GPK Foundation for organizing this very, very important talk. Thank you. Namaste.
Thank you. Next, few remarks, conclude, thanking note. John Mullohan at 28 Law.
Yes. Somnath, thank you. I just want to thank the GPK Kerala Foundation for putting together this distinguished panel. It was really an honor to be able to share my thoughts along with such distinguished people doing such incredible, important work all around the world. And I hope to continue to be a resource both to the foundation and also the other panelists, and help promote this work of human rights, because at the end of the day, we're talking about human rights that always has a global dimension, and the only way we're going to really improve our world is by working together. So thank you all again, and please continue to be inspired to do the work that really is changing lives.
Thank you, John. Next, Dr. Uzma Gul.
Thank you so much, Somnath ji, for inviting me. And thank you all the panelists who gave time and who are still with us, because I see the number reducing with the time. So thank you so much, Bharti ji, Brahmanand ji, DP, Vivinia, John, Sumitra, and everyone who is still with us. And I hope to stay together for the constructive causes, because without being with each other and without supporting each other, we cannot come out of the big crisis we are facing right now. So thank you and good luck, everyone.
Thank you, Uzma. The next, Sumitra Magrati.
First of all, thank you so much, Som sir, for having me here. And it's a really great honor to be here. And thank you, everyone. It is such an amazing program. Thank you, everyone.
Thank you, Sumitra ji. Next, Viviana Kristovic.
Well, thank you very much for the opportunity of sharing and learning, and for the ideas, the poetry, and the hope that you live with us. Thank you.
Thank you again. And stay safe and healthy. Let us defeat the COVID-19 as soon as we can. Stay safe and healthy again. Goodbye. See you soon. Bye-bye. Namaste.
Thank you. Namaste.
DPG, you can say a few words.
Yeah, I thank Mr. Som for conducting this intellectual meeting, knowing about human needs and human rights. So I'm very much thankful to GPK Foundation and all the panelists who are, most of them are not known to me, but few are known to me from Nepal. So I thank you for joining this intellectual group together. Thank you very much.
Thank you. Bye-bye.
Bye-bye.
Stay safe again. Take care.
Thank you.